Our next speaker is Emmanuel Bacry. Emmanuel is a mathematician and AI expert at the CNRS Research Directorate at Paris Dauphine University. So once we've got the slide deck up and running, we will look forward to hearing Emmanuel's talk, where Emmanuel will be trying to tell us a little bit about how AI can get involved in health, the challenges and the solutions. Emmanuel.
Sure. Thank you. Thank you very much for inviting me. So, my talk will be twofold. I'll be first doing an introduction about AI. What do we mean when we're talking about AI? Yes, sure. So what do we mean about AI? And then the second part of the talk, I'll be talking about main applications in health and challenges. Okay. So first, what do we mean when we talk about AI? So today, if you put aside all the buzz around all the GPTs like ChatGPT like discussion, mainly when we talk about AI and when you look at the kind of AI that is currently deployed in production, let's say 90% of it is what we call supervised AI. Supervised AI means what? Is the fact that the expert gives examples of what she or he expects from the AI. Okay, this is the stupid example that you all know. Okay, it's not very interesting, but this is really the paradigm of supervised learning, supervised AI. And again, 95% of the deployed AI is supervised learning today. Okay, so now for health, of course, it's mainly most of it today that is deployed. It's about images and it's about reading images. So here you see an example of a famous algorithm, famous AI algorithm that detects pneumonia from X-rays. It's what we call a deep learning algorithm, like deep because it has 121 layers. So it's a lot of computations. And trained on 100K images because we need for this kind of task a lot of images, a lot of data. And it was trained on 14 pathologies. This is very interesting. To detect one pathology, it's better to try to detect 14 and then you focus on one. This is a common thing in AI. Okay, so this is mainly what is deployed. Now I cannot escape from talking about what we are all talking today. I mean, not today here, but in AI, which is the Gen AI and so on. And the technical word behind this Gen AI, which is the vulgarized form of this, of how we call this AI, is what we call self-supervised learning. So what do we mean by self-supervised? It's exactly like supervised learning, except that the computer supervise itself. So it's not the human being that supervises the algorithm, but the algorithm self-supervise itself, okay? So algorithm is driven by supervision for solving tasks. However, tasks are chosen to be very simple to supervise. So supervision is therefore made by the machine itself, and there is no human intervention. Okay, so you don't have an expert which says here there is a cancer or here whatever. Okay, so but then what the hell is it used for? I mean, we don't understand why. If it's so easy, then why do we do that? It's clearly, a priori, at least historically, it was clearly not for the task that was self-supervised. We don't care about this task. It's a pretext task. And the real task is the fact that we hope that doing this pretext task, learning this pretext task, the algorithm will learn semantic representations of the data. Okay, and it will learn how to encode and decode to and from this learned representation, and this learned representation will be used all over the place in the development of other AIs. That was the main goal. And then you had the ChatGPT. I'll come back to that. But that was the main goal of this kind of AI. Okay, so let me give you an example when we're talking about large language models, the LLM. Okay, so here I'm talking about GPT. I'm still not talking about ChatGPT. Okay, so you need a huge number of texts. I think you know that, And what are these pretext tasks? Basically, there are two types for these LLMs, and this is really the only tasks they try to solve. The first one is I hide a word in a text, and it has to find what is the word missing. So you see, this is an easy task because the computer has the whole text. So basically, it's like there are two computers, and the one asking the other one, you have to find the word, and then if it's right, it says okay, or otherwise, if it says it's wrong. And find the next word of a small truncated text. Okay, that's what GPT is doing. That's why it knows how to do compilation of sentences. Okay, that will be one application. So these are the pretext tasks. So what are these representations that we hope it learns doing that? Let me give you a very simple example that is a little outdated today, but it gives you just an example. So this is something that is called Word2Vec. It's about 7 years old or 10 years old, okay? So basically it learns, in this example, it learns how to represent each word in what we call a vector space. So you have like coordinates, like if you had the 3-dimensional space, you have X, Y, Z, okay? Here you have not X, Y, Z, you have 200 dimensions, but it finds location of each word in this space. And the location I found so that words that are close in terms of semantic are closed in this space. And you can do arithmetic on the words. So for instance, if you take king and you subtract on each line or each coordinate, you subtract the word man and you add woman, you find the word queen. So basically it captured something. That was the goal of the pretext task. Okay? So what are they used for, all these representations or these large models? Well, mainly for the fine-tuning, meaning that once you learned fine-tuning of other AI, meaning that once you learn the representations of all the words, then if you want to do something on the medical reports, and you want to find some words or to find some coding of a pathology and so on, the first thing you do to build an AI, you encode the medical report using the representation that was learned by the large model. And once you do that, you do a regular supervised learning algorithm with an AI. Okay, so we mutualize some training about learning representation, and then we use this representation for other AIs. This is the main application of these representations. And of course, now today we speak a lot about Gen AI. Okay, now Gen AI means generate new contents. Okay, and again, the first application of Gen AI is not the chatbot, okay, that you all heard about, but it's data augmentation. It's the fact that for training regular supervised AI, we need a lot of data, and generally we don't have enough. So we need another AI to generate more data. Okay, that's one application, and that's what we call data augmentation. This is very classical today. All the supervised learning on X-rays or whatever images, they have been trained on true images and at least the same number of images, but synthetic images generated by Gen AI. Okay. What does it mean wrong? This is very hard. Let me go on, because the wrong, what you call wrong, what does it mean? Like when you see an image, when you see Midjourney and they generate an image, when do you say it's wrong? When do you say it's true? Okay. In that,
can we let can we get to the end?
No, but that's a good question. That's a very good question.
Hold the question, Carmini.
Sorry. Now, I'm supposed to just last 20 minutes. So that's hard. Now, you've seen the pretext task for the LLM was talking about, which was guessing the next word. So in that way, you generate sentences. That's exactly what you will do with ChatGPT. Guess the next word, guess the next word, guess the next word. And that's how you generate a sentence. Okay, so of course, That's one application which we talk about a lot. There are a lot of applications here. I will see some healthcare applications, of course. Now there is a big challenge here, building multimodal representations. Okay, not just text. Text plus image, GPT-4 does that, Midjourney does that, okay? But now text plus image plus audio plus 3D plus genomic plus X-rays plus whatever, plus patient health pathways and so on, okay? People are working on that today. This is important. So quickly, one slide on the chatbot because I cannot not say that. So you have GPT. Okay, GPT was since 2018 was able to just chat with you. Okay, it's not new. Now there was a problem because it became very easily racist, xenophobic, or whatever. Okay, so they added a layer of kind of censorship according to what rules nobody knows. Okay, if you go in China and you use the LLM in China, it's very clear in the law in China. It says that the censorship of LLMs should follow the morals of the political party. Okay, now what is the moral of OpenAI? We don't know, and nobody knows. Okay, so consequently, that means what? That means that the chatbots, all these ChatGPT and all the other ones, do not have any model of knowledge, logic, and grammar. That means that, and I'm really stressing that, if you look at all the training process of all these models we are talking today, at none of the steps, we are interested in saying the truth. We don't care about that. We don't care because we don't know how to address this problem, basically, okay? Not even considering what does it mean truth, okay? But even for basic truth where everybody agrees, we don't know how to put that in an LLM. Nobody knows. Okay, so this is very important. So when ChatGPT says something that is wrong, it's not a model error. We never taught it to say something true. It is natural. So just be aware when you are chatting with such a thing that it's normal if it says something that is wrong. Okay, it's not. What is abnormal is that it says so little. I mean, it's pretty rare. I mean, everybody was kind of surprised that it doesn't say only wrong things. This is the surprising thing. Okay, so supervised AI for health. We've seen diagnostic aid, radiology, but you have surgeon aid. There are a lot of AI today here. I mean, most of the deployed AI is on radiology. You have a lot of medical devices on images, not just radiology, any kind of images. I'm not going to tell you, I'm not an expert in precision medicine. I'm going to give you a definition of precision medicine. Okay, I would feel ridiculous. Now in oncology, of course, that's where it started, kind of, what treatment to give a patient based on the molecular characteristic of his tumor and his medical record. And there are many challenges here. What treatment to give given the characteristics of the tumor? This is something that, okay, AI knows kind of how to do it, and it started. Now, there are some stuff that are hard, and which is how to deal with all the data that we have. And there are types that are extremely different, okay? So how to feed the AI with all this data? What is easy is when you have structured like tabular data with non-longitudinal data, not time. Then that's easy. There are classical ways of building AI on that, and that's easy. Now, much harder, you have combinations of unstructured data, so like images, genomic, and medical reports, and longitudinal data. And the worst are like the ones where you have like events happening at random times, not like a regular uniformly sampled signal. That's, we know how to deal with it. But if you have claim or electronic health record data, this is really hard to put into an AI, and it's even harder when you combine it with that. And nobody knows really how to do that. And the hope is that the representation of the large models, if we are able to do multimodal representation, then that's what we should do, okay? But it's an open challenge, and we don't know how to do that yet. I mean, people are doing it. I showed you Word2Vec. So for instance, there is a famous paper, it's called Patient2Vec. Okay, where a patient is, we are trying to learn the representation of a patient coded by its the whole history of also all the claims, for instance. Prevention, this is also a very important application for AI, identification of risk factors, risk forecasting, and everything that comes with IoT and AI apps that are, of course, that could be a diagnostic aid and so on. Public health, healthcare pathway optimization. This is extremely important, very hard to address with AI, but a lot of people are working on that, but we are far from solving that. Pharmacovigilance, automatic screening of medications with adverse drug reaction. So here it's interesting. The state-of-the-art algorithm is like survival analysis, and AI doesn't perform better than that. Now, the problem with survival analysis is that you have to ask a specific question. Do I have this adverse effect with this medication? I'm simplifying, but it's kind of that, okay? Now, what we would need is an algorithm that just screens all the drugs on the market today, all the kind of adverse effects, and would say, haha, you have to look carefully at this one. And then we run the state-of-the-art algorithm. Okay, so the screening, a lot of people are working on AI on this screening. So LLMs for health, yes. For why not? For diagnostic of complex cases. So to help, it's in a discussion with the doctor, but the doctor should always be aware that maybe GPT is saying something totally absurd. That's the important thing. But otherwise, it's a very good brainstorming tool. Okay. There are now specialized LLM on health, so especially in the US. So you have MedPalm 2, which is a worldwide reference by Google. Okay, it's very, very hard to rate these algorithms, extremely hard. Okay, there is no standard for rating them and to see how precise they are, because they are supposed to do everything. So how can you judge them? Okay, so for instance, they give you this kind of scores on multiple choice tests, but this is ridiculous. It's not made for that. So okay, even if you gain a few percentage, it's not very important. Writing reports on notes from audio. There are many solutions now, and this is a big boom of LLMs on this application. Now, generative AI for clinical research. The challenges are very important. I mean, I guess you know why. I mean, the promise is that it's going to cost much less money and it's going to go much faster to develop medications. Now, there is drug design. So it's a different type of Gen AI. You have now AI that generate new structure for molecules with specific requirements compared to some proteins and so on. Okay, so this is Gen AI. So you have different forms of that. Some none of these medications are still on the market. I think they are in phase 3. I think some of the medications following this thing are in phase 3, but none are on the market, even in the US. And then you have Gen AI used for clinical trials at every step, but one of the main steps is the phase 3, where you want to have some synthetic control arms. So there are plenty of different ways of doing that. One way would be like, let's say I'm in a cohort and it's about cancer. Now, the AI will generate what would happen to my cancer, how it would evolve if I continue taking the same medication, okay? And we imagine how the tumor evolves and so on. So the AI predicts that. And now I'm taking the drug that is used for the clinical trial, okay? And then we are going to compare myself. So I'm my own control. I mean, with the virtual myself, okay? So this is very important. This is a huge boom, and it's hard to have the number, but there are at least 2 medications on the market in the US that used at some point some synthetic control arms, but there are many modalities for that, and it's not the one I was talking about. And I want to finish by 2 major challenges. There are still open challenges. So this is the black box challenge, meaning what? Meaning we know exactly the computation the AI is doing, okay? Now we want to understand it. We want the AI to be able to explain the choice. Okay, it's like if I was in the hospital and an AI told me you can go out of the hospital, and I say why, and they give the formula to compute with whatever you can imagine. Okay, and they say, okay, if you compute this formula, you reach the number 0.6. If it's above 0.5, it means you can go out. Okay, great. What do I do with that? Okay, we want somebody to tell us so you can go out of the hospital because your fever went down or something like that. This is what we call the black box problem. Okay, so this is very important for applications like health applications, of course. So a lot of researchers are working on that, and it is very hard. And of course, the more complex the AI algorithms are, the more complex it is to do that. So on LLMs, forget about that. Forget. I mean, we're not even far from it. It's totally unreachable to have explainability for this big model. Okay, so that's one challenge. The second one. So when Marion invited me, she told me, okay, in the near future, we'll all have data centers with all the data and so on. So now what do we do next? So I'm sorry to tell you that it's not the near future. I think the main problem today is the data. And it's going to take very long. Maybe you have nice data and you are very lucky, but it's still, I do still think today that the main challenge and the main revolution, when we talk about revolution of AI, it's mainly revolution of data. If we had good data, and I'll explain what I mean by that. I mean, even not doing AI, we would do amazing things without AI. And then with AI that is already exists, we could do a lot of things. And then with the new models, of course, a lot. But this is the bad news, I think, but maybe you don't agree. But the bad news, I think, is that revolution of data is going to take for a very, very, very long time. So what do I mean by that? Here, I just named three, I think, universal challenges related to data. It's not specific to any country. Everybody has this problem. You want to find some data. Which data is where? It's a mess in every country. You don't know. This is very, very hard. Okay. Governance. You want to access some data? Well, I can tell you about France, about that. You can wait sometimes for 3 years, 4 years, 5 years, you know, and sometimes you just still wait for the answer and you'll never get an answer. Okay. And all the problems about having high quality data, unbiased data, interoperable data that are so important and that are so hard to do, to be sure that, so interoperability, it means several things, but one of the things is semantic interoperability, meaning that the way you build up the data is really the same way as the other database you want to merge with. Okay, so for instance, for COVID, that was a main issue in France. When at the beginning of COVID, there were hardly any PCR tests. Every emergency service was coding COVID on different criteria. Okay, so you can put all the data together. You don't do anything with it. It's useless. Okay, this is also something, of course, you could, this kind of problem, you have it with everything, but it's even more critical when you are working on rare diseases, for instance. On rare diseases, you have to collect data from all over the world. You want to be sure to be talking about the same disease exactly. Otherwise, it's not possible to, I mean, it's useless. These are really, each of these tasks is like a huge task. Hopefully we are going forward. And in Europe, there is this new law, I don't know if you heard about it, that was voted by the Commission that will change quite a lot of things. I'm not totally sure that it's going to be good. It's going to go in the good direction. You know, it's like the AI Act. We know we need to regulate, but we're always afraid that the regulation is going to kill innovation. So it's hard to know till it really happens and to see exactly how it will be applied. So it kind of same thing, I think, for that, but hopefully it will be good. That's it. Thank you very much